Welcome back to the deep dive. Okay, today we're tackling something that, well, it makes almost everyone a bit nervous, visiting the doctor.
Uh-huh.
But we're adding a layer, a big one, doing it when English isn't your first language.
Yeah, and that's a huge challenge. I mean, going to the doctor is stressful anyway, right, for anyone.
Totally.
But our sources, they're really clear on this. That anxiety, it just shoots up like exponentially when you add that feeling of, linguistic vulnerability.
Right. It's not just about, oh, did I miss something?
No, it's deeper. It's the fear you might misunderstand a diagnosis. Or, maybe worse, you can't quite explain what's wrong with your own body, failing to translate that key symptom.
Okay, so let's get into this. Our mission today really is to give you a toolkit, both linguistic, the words, but also practical steps.
Exactly. Because effective communication, it's everything. It's the absolute bedrock of good healthcare. That's what the research keeps showing.
We want to help you shift from feeling maybe a bit passive or vulnerable to being, well, an active partner in your own care, empowered.
That's the goal. Think about it like this. Your job when you walk into that appointment is to be the clearest, most precise translator for your own body.
Translating those signals, like a sharp pain versus a dull ache.
Precisely. Because the doctor's diagnosis, it's only ever going to be as good as the information they get from you. So we need to nail down the language for pain, feeling unwell, urgency, all of it.
Okay, so where do we start? Logically, it begins way before you're actually in the exam room, right?
Absolutely. Preparation is power. That's what we're calling it. And step one is often that first hurdle, just making the appointment.
Yeah, the phone call.
Yeah, that initial conversation with the receptionist. You need to kind of anticipate the script.
So have some phrases ready.
Definitely. Simple things like, hello, I'd like to make an appointment to see Dr. Smith, please. Or maybe I need to schedule a follow-up appointment. Just having those ready helps.
And then comes the vocabulary barrage.
Right away, yeah. The last thing's like, is this for a routine checkup? Or maybe a physical?
And crucially, urgency and insurance. That's often where confidence dips, isn't it? Right at the start.
It really is. That admin vocabulary, if it feels high stakes, they might ask about your insurance information, maybe even use terms like prior authorization.
Or are you in network?
Exactly. Knowing what in-network means, basically, that your insurance plan covers this specific doctor or clinic that takes away a huge chunk of stress before you even start talking symptoms.
Super useful. And that point about urgency the sources make knowing the difference, is this something for your regular doctor, like a cough that won't quit?
Or is it something really serious right now that needs A&E, or the ER, as they say in the U.S., knowing that distinction is vital.
Okay, so appointment made. Now the prep work itself, you call it the personal health briefing.
Yeah, it's your homework, basically. And the reason you do it is to stop that stress-induced blocking.
Yeah.
When your mind just goes completely blank.
Oh yeah. The moment the doctor asks, so what's wrong?
Exactly. And the single most important piece of this homework, write down your symptoms.
Don't just rely on memory.
No way. Just writing them down helps organize everything. It calms the chaos a bit.
Okay, number 1, symptoms written down. What's next?
Number 2, list your medications. And I mean all of them.
Not just the prescription stuff.
No, everything. Prescription
Yeah.
drugs, obviously. But also any over-the-counter things, pain relievers, cold medicine,
Like ibuprofen, paracetamol.
right, and vitamins, herbal supplements, anything you take regularly.
Why is that level of detail so important? Like the dosage of a vitamin. Does the doctor really care about that?
Oh, absolutely. Great question. The sources point to 2 big reasons. First, OTC meds can actually mask how bad a symptom really is.
Okay, so if you're loaded up on painkillers.
The doctor might not realize how much pain you're actually in. And second, and this is critical, supplements and even common OTC drugs can have really dangerous interactions with prescription meds.
Right, that makes sense.
So you need the name and the dosage, how much, how often. Write it all down.
Okay, vital details. So symptoms, meds. What's number 3 for the briefing?
Your medical history. Be ready to talk about allergies, especially medication allergies like penicillin. That's a big one. Any chronic conditions you have, like asthma, diabetes, high blood pressure, and relevant family history too, stuff that runs in the family like heart disease or certain cancers.
Got it. And the last part of the homework.
Prepare your questions. Remember, this isn't just you reporting symptoms. It's a two-way street.
So think beforehand what you need to know.
Yes. The sources suggest focusing on understanding the what And the what next, like what do you think might be causing this, or what tests will I need?
And about the treatment.
Definitely ask, are there any side effects I should watch out for with this medication? Don't leave confused.
Okay, prep done. You've got your notes, you've got your questions. Now you're in the room, the main event.
Right. And this is where precision is everything. The doctor asks that classic question. So what seems to be the problem?
And you need to be ready with the what, where, when, and how,
Yeah.
like a detective.
Exactly like a detective. And we need to spend a bit of time here because this is where the words you choose directly impact the diagnosis. We have to get beyond just saying pain.
We need the specifics, the language of pain.
Yes. Type, location, severity, and pattern. Let's break down type first. These words tell very different stories.
Okay, so if it's sudden, really intense, like being stabbed.
That's a sharp pain.
Yeah.
Often means something acute, specific, a pulled muscle maybe, or a sudden issue.
Versus a dull ache.
Right. That's more persistent, low level, kind of steady discomfort. Often points to something more chronic, muscle soreness, maybe just feeling generally unwell.
Then there's the pulse-like one.
Throbbing pain, yeah, like a heartbeat. Often linked to inflammation, headaches, that kind of thing.
What about things that aren't exactly pain, but still sensations, like heat?
Good one. That's a burning sensation. Could suggest nerve issues or maybe acid reflux if it's in the chest.
And if the pain sort of travels, like down your leg.
That's a shooting pain. Often follows a nerve path. And don't forget cramp, that tight, intense muscle contraction pain.
Okay, types covered. Severity.
Use the 1 to 10 scale if they ask, but also use words. Is it mild, moderate, or really bad, like severe or even excruciating?
And pattern. This seems crucial too.
Hugely. Is the pain constant, always there, or is it intermittent? Does it come and go?
Right.
And here's the detail that really elevates your description. What makes it better or worse?
Ah, the triggers and relievers.
Exactly. It gets worse when I lie flat, or it seems to be triggered by spicy food. That context is gold dust for the doctor.
Makes sense. Okay, beyond pain, what about general illness words? These get mixed up a lot, don't they?
They really do. Let's take coughs. You have to distinguish, is it a dry cough with no mucus, or is it productive, sometimes called a wet cough, where you're coughing stuff up?
Phlegm.
Right. And for your nose, is it a runny nose where stuff is dripping out, or is it a stuffy nose, feeling congested, hard to breathe through?
Okay. Other common cold or flu symptoms.
Feeling really tired, that's fatigued or lethargic. General muscle soreness is body aches. And feeling cold even when you're not, that's having the chills.
What about stomach issues?
Key difference. Feeling like you might be sick is being nauseous or feeling sick to your stomach.
Versus actually being sick.
Right. That's vomiting or throwing up. Need the right term.
And the results, so to speak.
Diarrhea, or the opposite, being constipated.
Yeah.
That burning in your chest is heartburn or acid reflux. And feeling uncomfortably full of gas is feeling bloated.
Okay, there's one pair of words the sources highlight as really important to get right. Dizzy versus vertigo.
Yes. This is a fantastic example of linguistic precision mattering hugely for diagnosis.
So feeling like you might faint, unsteady.
That's feeling dizzy or maybe lightheaded. It's a general feeling of instability.
But vertigo is different.
Totally different. Vertigo is when you feel like the room itself is spinning around you, or you're spinning, like being on a merry-go-round.
And using that specific word, vertigo, tells the doctor something important immediately.
Absolutely. It instantly points them towards potential inner ear problems or maybe neurological issues, rather than just, say, low blood pressure. It saves diagnostic time. That one word carries real weight.
Fascinating. Any other key symptom terms?
A few more common ones. Difficulty breathing, feeling like you can't get enough air, that's being short of breath.
And that whistling sound when breathing.
That's wheezing, often linked to asthma or bronchitis. And for sleep issues, trouble falling asleep or staying asleep is insomnia. Feeling tired and out of it in the morning is feeling groggy.
Okay. And one last thing before we move on the timeline.
Yes.
Always tell them when it started.
Oh.
3 days ago. It's been on and off for months. And how it started. Was it very sudden? Or did it creep up, getting gradually worse?
That history helps figure out if it's acute or chronic.
Exactly. Vital context.
Right, so you've given your report, used your precise language. Now the conversation flips.
Segment 3. Understanding the doctor. This is about active listening.
Making sure you get what they're saying. Precisely. And they'll be asking targeted questions now, trying to narrow things down, or rule out possibilities, as they often say.
So you should expect questions like,
Does anything make it better or worse? We mentioned that, but they'll
Oh.
ask again.
Mm.
Also, are you taking anything for it? Like any painkillers or remedies?
And the lifestyle questions?
Yep. Be ready for those. Diet, exercise, smoking, alcohol. And honestly, just be honest. It feels awkward sometimes, maybe embarrassing, but hiding stuff only makes it harder to get the right diagnosis.
Okay. Then comes the physical exam.
Right. And they'll usually tell you what they're doing. You'll hear things like, okay, I'm just going to listen to your heart and lungs now.
Could you take a deep breath for me?
Exactly. Standard stuff.
Yeah.
But there's one word you really need to listen for during the exam. Tender.
Tender.
Yeah. If the doctor presses somewhere, say on your abdomen, and asks, is that tender? They mean, does it hurt when I touch it right there?
Oh, okay. Painful when touched. Good to know. What about if they want you to see someone else?
If they suggest seeing a specialist, or maybe getting an x-ray or scan, the term they'll use is refer. I'm going to refer you to a cardiologist.
Okay. Referral. Got it. Then, hopefully, comes the diagnosis and the plan.
Hopefully. Sometimes it's straightforward, looks like a case of the flu. Other times it might be less certain. They might say, well, I'd like to run some tests just to rule out a few things.
And rule out just means eliminate possibilities.
Exactly. Don't let the phrase worry you. Now, if they prescribe medicine,
The paper they give you for the pharmacy is the prescription.
correct. And you absolutely must be clear on the dosage, how much medicine, how often, and any special instructions.
Like take with food or on an empty stomach.
Right. And always, always ask about potential side effects. What should I look out for?
And then there's the standard advice.
Get plenty of rest, drink lots of fluids. You'll hear that a lot.
Mm.
But there's one piece of advice the sources really flag as critical for safety. The what-if instruction. Something like, okay, if you're not feeling better in, say, 3 days, or if you start to feel worse, you need to give me a call. Or sometimes, come back in. Pay close attention to that.
That's the safety net instruction.
It really is. Now, here's where the power dynamic can feel tricky, which shouldn't. Asking questions.
Feeling like your English isn't good enough to ask.
Exactly. But asking for clarification isn't the sign of poor English. It's a sign you're engaged, you're taking responsibility. It's actually sophisticated patient behavior.
So it's totally okay to say.
Absolutely. Things like, I'm sorry I didn't quite catch that. Could you explain the diagnosis again, maybe in a simpler way? There's no shame in that.
Or if there's a long medical word or drug name.
Just ask. Can you spell that for me, please? Simple. And here's the real pro tip from the sources. The confirmation technique.
Which is?
Repeating the instructions back to the doctor in your own words.
Ah, like a summary.
Exactly. Okay, so just to make sure I understand, you want me to take this blue pill once in the morning and once at night for 7 days. Is that right?
That clarifies it for both of you.
Perfectly. It catches any misunderstandings before you even leave the room. It's probably the single best act of kind of linguistic self-advocacy you can do.
Okay, wow. We've covered a lot. Let's try and distill this. What's the big takeaway?
I think the final insight is that learning this specific type of vocabulary isn't just, improving your English generally. It's much more fundamental. It's an investment in your own health.
An act of self-care, almost.
It really is.
Yeah.
Knowing the difference between saying, my stomach hurts, and saying, I have a sharp cramp-like pain here, and it comes on after I eat dairy. That difference in clarity, that directly leads to a faster, better diagnosis.
So the pillars are prepare before you go.
Be a good detective with precise words.
And be an active listener, ask, clarify, confirm.
Those are the keys.
Okay, final thought to leave everyone with. Let's go back to that safety net instruction. Imagine the doctor tells Maria, who has a bad cold, call me if you get worse.
Right.
But maybe the doctor was more specific. Call immediately if you become short of breath or if your cough starts bringing up thick, colored phlegm.
Okay, the specific warning signs.
Exactly. So the question for you, the listener, is how fluent are you in that language of escalation?
Knowing the words that signal when something's tipping over from unwell to urgent.
Yeah. Understanding those specific terms beyond the initial symptoms you went in with, that's maybe the final piece of this linguistic puzzle that really protects your health. Something to think about.